This is the second part of the jaw series, and we are going to be working with the structure up here in the head and also in the upper part of your neck. Yeah, the first two joints, C1 and C2, cervical spine number 1, cervical vertebrae number 2. I want you to check out this video called suboccipital. I have exercises for you to work to release the top two part of the top two bones of the neck, which is going to help with loosen up the tension in the neck and the whole spine. It's called suboccipital. So do that one first on the floor, lying on the mat, and then you come back and watch this one. You start with pressing the back of the neck, the back of the head back onto the spine. Okay, so from here, the back of the head back onto the spine, onto the neck. Okay, most of us have this posture where the head is slightly forward or a lot forward. So think of actually more precisely, the base of your head onto the top part of your neck. Okay, the base of your head onto the top two bones in your neck. This is for those of you who have a forward head tilt like this, but if you have a neck structure which is like this, you will not need this exercise. Okay, you will not need this exercise. You will need to do this. Yeah, if your neck is back like that, you will need to lift the chin up and down to help with the release of these bones in the back. Okay, go up and down like that. Yeah, keep the neck still, and then you go up and down like this. Very small nodding movement from the head on your bone. Okay, so let's go back to the previous one. Okay, assuming that you have a forward head like this, you press the back of the base of your skull onto the very top of the neck. Okay. Sitting up straight can help a lot. Okay. Now it's quite hard to feel when you're seated. That's why I want you to do the suboccipital exercise first. Next one is called the head nod. Put your hand behind the head. Start with just pressing your head gently on top of the neck bones, and then you start to nod your nose towards your chin, and then up. Nose to your chin, and then up. Notice that I said nose to your chin, I didn't say nose to your throat. So which means the movement is small. Nose to your chin. Nose to your chin. Okay. Slowly. You have to be very patient with these exercises. Now, because you're working in an area where you don't feel like it is working. Okay, so for some of us, maybe you may feel quite irritated, right? What am I working on right now? Yeah? So here, nod your nose to your chin. Nose to your chin. The top two bones in your neck, they're situated right in line with the nose in the back, right? So when you're nodding your nose, yeah, when you're nodding your nose, you are moving your skull. So this is the C1, yeah, which is the cervical spine number 1. You're rolling your skull on this bone, on C1, cervical vertebrae number 1. Okay, and then you are helping these suboccipital muscles become more relaxed and release. The next one is more like a strengthening exercise. So first, you nod your nose, so press your head back a little bit first, right? Press your skull back on top of the neck gently, and then you nod your nose to your chin, and then you switch your fingers to the front on your forehead and then you press your forehead very gently into your fingers. When you do the pressing, you should not be changing the alignment of your neck. Okay? Great. Okay, we're gonna do that again. Recap. First, put your hands behind, your fingers behind your head. Bring the back of the skull onto the back of the neck. So your chin is already tucked in slightly. Okay? And then nod your nose to your chin. This is the second part. The third part is to press the forehead into your fingers slightly. And for some of you, you may feel it in the back of the skull, the base of the skull. There's some muscle activation there. Not a lot, but you may feel something there. Okay? We'll do that again together. Sit up straight. Hand behind your skull. Press the back of the head into your hand towards the back of your neck. And then nod your nose towards your chin. That's the second part. The third part is to press the forehead very gently into your fingers. This is not just for jaw. If you have a misalignment in your head, neck, and shoulders, it will be great for you. And now let's work with the jaw. Okay. Look at yourself in the mirror for this one. Yeah. And I want you to put your fingers right on the lower jawbone, right under the TMJ, lower jawbone, like this. Okay. And then slowly open your jaw. And close. The reason for looking at yourself in the mirror is because you want the jaw to go straight down without deviation. Yeah. Now, when there is a clicking, clunking going on, I want you to stop. Okay, stop. Do less of the movement. Okay, so just stop right before you you click and clunk. Okay, you click and clunk, and then keep the jaw even on both sides. So you open your jaw going straight down. Now, if you have a physiotherapist who can specialize or who is specialized in this part of the body, please go see the therapist. Yeah, it's better to get diagnosed and then get treated. Now, the last part of this exercise, this video, is isometric contraction of the muscles for closing and opening of the jaw. Okay, so I want you to have a very relaxed jaw now. Press the tongue on the roof of your mouth. Okay, and relax your jaw. And then use your finger, maybe your thumb here. Try to open your jaw, but your thumb resisting it. Okay, so it's like you're trying to open your jaw, but your thumb is trying to stop it from doing so. Okay, and we tried it again. I have some space between my top and bottom teeth, but my tongue is engaged up the roof of my mouth. Okay, so the next one is you put the fingers on the front of the chin, and then you try to close your jaw, but your fingers are trying to resist the closing of the motion, the closing motion. The tongue stay on the roof of your mouth. So it's like you're trying to close your teeth, but your fingers are resisting it. The force is very small, yeah? So the resistance is very small. Please be gentle. The next one, you are going to move your jaw from side to side. Put your fingers on the sides of your jaw here. And I want you to shift your jaw to your right side. Okay. When you do that, the right fingers will resist the movement towards that side. And then to the left. And then to the right. And then left. Okay? You will feel some muscle activation on the side of your jaw, right around this part of your face. Hold about a few seconds with each side and do not use too much of a force. Okay? It should not be uncomfortable. And I want to remind you also, when you're doing the jaw opening and also the isometric exercise for the muscles in your jaw, you need to keep your head on top of your neck, okay? All right, so I'll see you in the third part of the video, which is the massage of the various bones in the face.